Honestly, I'm so tired of doctors coercing their patients to do things that hurt them.
It was just extremely traumatizing, so my heart goes out to all the other mothers who were affected.
It was a criminal act.
She was never even supposed to make it to 6 months old.
Then within another 10 minutes, we were off to emergency C-section.
Let me get this out of the way. Pitocin can be really helpful sometimes, like if labor stops and the baby is in trouble, or the mom's water broke 24 to 48 hours ago and the contractions have not started. But most of the cases of Pitocin's use are not for the reasons that I just said. Today, about 40% of laboring women report being induced. And when people were asked why they wanted the induction, this is what they said: "Baby is looking pretty big. I don't want to miss my vacation. I'm just so tired of being pregnant." I cannot express this enough. These are not good reasons to get an induction. And I'm not the only one who's concerned about the overuse of Pitocin. Just listen to what this doctor says.
Pitocin is really the mainstay drug in obstetrics, but like any drug, it can be used inappropriately, and those risks with Pitocin extend not just to the mother, but also to the fetus.
One big problem is that moms don't always know about the bad things that can happen when they use Pitocin, and some doctors are taking advantage of this lack of knowledge to do things that they should not be doing. Let me tell you about this crazy story. There was a nurse who was accused of injecting Pitocin into her clients without them knowing or saying that it was okay. Now, before I tell you more about this story, I should say that the Department of Justice reviewed the file and they threw out the case because there was insufficient evidence to proceed with the charges. The thing is, according to CBC, an internal investigation revealed strong evidence that the nurse administered oxytocin to at least 2 patients without consent, which caused the women to require an urgent cesarean section. And in the court filing, it says, obstetricians at the hospital were concerned about the increasing number of emergency C-sections requiring general anesthetic, and they were trying to determine the reason for it. On top of that, there are claims that the hospital knew about it before all of this happened and failed to investigate earlier on. For full disclosure, the New Brunswick Nurses Association suspended her license, and till date, she's not a practicing nurse in the state of New Brunswick. This is why I always say that you should check the induction and C-section rates for your hospital and your care provider. But when I say it, some of you will be coming for me. Oh, by the way, if you want to know if an intervention is truly necessary, check out this video where I talk about some questions you should ask before agreeing to any intervention. But more on Pitocin. Pitocin was made to resemble oxytocin, which is the natural hormone that causes contractions. But Pitocin is not an exact replica of oxytocin. A big way to tell the difference is to look at how the contractions from Pitocin act compared to the natural contractions that are formed by oxytocin. When a woman gets Pitocin, the contractions are much stronger and closer together than the natural ones. This can cause problems like more pain or even tearing of the uterus. That's what happened to this mama.
So Jolene was injured during birth. I had a uterine rupture that went ignored, and she went 48 minutes without oxygen. Her main condition is HIE, which stands for hypoxic ischemic encephalopathy. And then from that, she has a list of other diagnoses. She has epilepsy, severe dysphagia, she cannot swallow at all, cerebral palsy, hypertonia, she has a CBI, a hearing impairment, she's G-tube dependent, global developmental delay, hearing loss, and she's got a couple other minor things. She was never even supposed to make it to 6 months old, but here she is 3.5 years later, and she is thriving. And let me throw in there that I had a uterine rupture because of Pitocin. So many people assume that it's because Jolene was a VBAC, but she actually was not. Of all 6 of my births, Jolene was my only C-section, so she was not a VBAC. The only reason why my uterus ruptured was because I received Pitocin. If you have any other questions about her, please ask.
When I first heard about her story, I was so heartbroken at how the medical system failed her. But she's making the best out of her situation by caring for her baby while teaching people on the dangers of overusing Pitocin. Another side effect that most women are not aware of is the higher risk of C-section and epidural when you use Pitocin. Here's how it usually happens. So you're hooked to the IV to receive Pitocin and attached to the continuous fetal monitoring system. But as you can see here, this stops you from being able to move as much. On top of that, the contractions are so strong and you're not getting many breaks, so you request an epidural to help with the pain. Now you've restricted your movement even more, so the labor doesn't progress as smoothly. While you may not feel the contractions in your belly because of the epidural, the baby feels everything. This can be hard for the baby and make the baby very stressed. Because of that, the doctors might need to quickly do a surgery to get the baby out. Another thing is, the epidural can make it harder for you to push your baby out, and their heart rate could drop in the process. Then the doctors give you a cut to make a room for the vacuum or forceps to pull baby out. You believed that things would happen one way, and before you know it, they turn out very differently from what you signed up for. And the sad thing is that most women still don't recognize what happened, and instead they say things like, "Thank God I was in the hospital," or "Wow, that doctor really saved my life," when the whole thing could have been avoided in the first place. Studies have also shown that receiving Pitocin puts you at a higher risk of postpartum depression and anxiety. So now that I've brought this to your attention, what can you do about it? First, try to be patient. I know those last few weeks of pregnancy can feel like they're going on forever, but unless there's a real medical reason for baby to come out early, you're better off waiting for things to happen naturally. Next, do your research and ask the right questions before agreeing to any intervention. If you're not sure what questions to ask, check out this video where I talk about questions that you can ask when an intervention is suggested. Choose the right team. Medical coercion is real, guys. Make sure your nurse or your doctor listens to you and talks to you about what's happening. They shouldn't rush you into things without talking to you first. Choose a provider with low induction and C-section rates. It's also a good idea to have a doula by your side who will help guide you through the different decisions that you have to make and help you advocate for yourself. There's a reason why women who have a doula at their birth are less likely to need medical intervention, and it's because of the physical, emotional, and informational support that we doulas provide to our clients. You've got this. Let me know if you have any requests on topics that you'd like me to cover.